Medicare doesn't make any sense. So here at Healthcare Solutions Direct, our goal is always to make this as simple as 1, 2, 3 so that you are better informed about your options. We're going to talk about right now some incredible benefits that you're able to get through Medicare Advantage plans. Medicare Advantage plans can offer some incredible benefits, and the first benefit that makes a Medicare Advantage plan attractive is that the individual will have a calendar year out-of-pocket maximum limit for their hospital and their medical expenses. This is a benefit that's not provided to an individual that has original Medicare as their primary insurance. All Medicare Advantage plans are required in 2021 to have an out-of-pocket limit for hospital and medical expenses not to exceed $7,755 for in-network expenses and $11,300 for combined in-network and out-of-network expenses. According to the Kaiser Family Foundation, they reported that the average out-of-pocket limit is $4,925 for in-network services and $8,828 for both in-network and out-of-network services, which can be found in PPO plans, which we're going to talk about here in a little bit. To better understand Medicare Advantage plans, they will typically have a copay for doctor visits or services during the calendar year. Medicare Advantage plans operate on the premise of pay-as-you-go. So typically for doctor's visits, you'll have a copay when you go see a doctor. Now, one thing about Medicare Advantage plans, they typically will have a co-insurance responsibility for out-of-network, or if you have to use services like durable medical equipment, if you have to get some durable medical equipment or chemotherapy or dialysis, or if you receive any Part B drugs such as infusions, vaccinations, or injections, those typically fall under a 20% co-insurance with most Medicare Advantage plans. So for doctor visits and things like that, you're looking at usually a copay, but for more serious things like chemotherapy or durable medical equipment or infusions or vaccinations, those typically will come with a 20% co-insurance. So Medicare Advantage plans on the market, again, will typically have a 20% co-insurance for some of those major things. Here's some good news. This is something you don't have to tackle by yourself. The good news is you can call us here at Healthcare Solutions Direct and talk to a licensed insurance agent that can look up the plans in your area and go through every benefit with you so that you fully understand exactly what you're needing to do. See, most Medicare Advantage plans are zero premium. That's a very attractive benefit to a Medicare Advantage plan. Remember, we talked about before is that you will still be responsible for your Part B premiums in 2021. The standard Part B premium is $148.50 in 2021. The Kaiser Family Foundation is a nonprofit that reviewed Medicare Advantage plans across the country and reported in 2020 that most enrollees do not pay a monthly premium other than their Medicare Part B premium, which is a very, very good benefit for individuals that are on Medicare. Almost 60% of individuals have a Medicare Advantage plan that they're only responsible for the monthly Part B premium of $148.50, which is standard in 2021. So that's some really, really good news and a great benefit to a Medicare Advantage plan. Another incredible benefit with a Medicare Advantage plan is the convenience of having all the benefits of hospital, medical, and prescription drug coverage all in one plan for you. See, most Medicare Advantage plans on the market will provide the convenience of just one card for that individual to carry with them that will include the hospital, the medical, and the prescription drug coverage. The card will show the copay responsibility for the primary care doctor, the specialist, and also the emergency room visit. That's a big benefit with Medicare Advantage plans because somebody that has just original Medicare as their insurance would need to go ahead and purchase a Medigap supplement plan and also a PDP standalone prescription drug plan. So they would need to carry 3 separate cards with them. So the idea of having just one card is an incredible benefit that Medicare Advantage plans offer as a convenience to their members. Medicare Advantage plans cover some stuff that original Medicare does not cover. This is a very attractive benefit to Medicare Advantage plans with private insurance companies. Medicare Advantage plans will cover 3 big benefits that most people who are eligible for Medicare really, really want, which is dental, vision, and hearing coverage. You see, most Medicare Advantage plans will include some sort of coverage for these benefits. Now, each plan is very different in exactly what they cover on these 3 separate benefits. So it's really important that you reach out to us here at Healthcare Solutions Direct so that we can look at the different plans in your area so that we can better explain to you what would be best for your needs. The Kaiser Family Foundation, again, is a nonprofit that in 2020 reviewed additional benefits that were currently offered by Medicare Advantage plans. And besides the additional benefit of dental, vision, and hearing, they also concluded that they have access a lot of times to telehealth, fitness, and over-the-counter benefits with most plans right now on the market. So again, give us a call so that we can kind of go over everything with you on each plan so that you know exactly what you need to do for your health insurance. So let's talk right now about some of the other benefits like fitness, transportation, and over-the-counter benefits that are provided on a lot of Medicare Advantage plans. Most Medicare Advantage plans will offer free fitness memberships at local gyms or YMCA. This has always been a big benefit that those that are on Medicare really enjoy. It's a nice feature to help someone stay healthy without the added cost of a monthly fitness membership. Another really big benefit that's become very popular among Medicare Advantage offerings is transportation to and from medical appointments. The plans will offer the individual a certain number of trips towards medical appointments at no additional cost. This last one is a really big one that most Medicare Advantage plans are now starting to offer, is over-the-counter benefits by many of the Medicare Advantage plans. See, the individual will be able to get over-the-counter items such as allergy medication, cough drops, pain relievers, vitamins, and so much more. These benefits can be ordered online, over the phone, or by going to a participating store. Each plan will go ahead and give you a certain credit that you can use towards some of these over-the-counter items. Another benefit that Medicare Advantage plans offer as well is something called the Give Back. So some Medicare Advantage companies will offer a benefit called the Give Back or the Buy Down program. We touched on this a little bit on another video. This is where Medicare Advantage company will actually pay you to join their plan. See, when a Medicare Advantage plan bids below the benchmark, they're going to get what's called a rebate from CMS. Most plans will take that rebate and provide additional benefits to the plan, while others will use that rebate to give back or buy down someone's Part B premium. So the give back is where the Medicare Advantage plan will give back either the full Part B $148.50 standard monthly premium in 2021 or a portion of that towards someone's Social Security check. I can tell you that most plans that do the Give Back program will give a portion back to that individual. There's very few plans that will actually give the entire $148.50 back to that individual, but that's why it's so important to give us a call so we can look at all the different plans in your area so we can show you exactly which ones would best fit your needs when it comes down to your health insurance. Now that we've talked about some of the benefits to Medicare Advantage plans so that you are better informed, let's talk about some of the drawbacks to be aware of when it comes to Medicare Advantage plans so you can make the right decision for you. Medicare Advantage plans can offer some incredible benefits that we just went over. They're so hard to pass up, but there are some drawbacks to be aware of when someone enrolls away from the federal government's original Medicare Part A and Part B. An individual may find it hard to purchase a Medigap supplement plan in the future if they don't have a Medigap open enrollment OEP or a guaranteed issue. Because of health conditions, they may not be able to purchase a Medigap supplement plan. See, original Medicare operates on a private fee-for-service, which means that there are no networks with Medicare. It's estimated currently right now that 97% of all doctors and specialists in the United States do actually accept original Medicare A and B as the insurance. According to research done in 2019 by the Kaiser Family Foundation, which is a nonprofit, they report that over 60% of the plans offered on the market are HMO Health Maintenance Organization plans. These types of plans will typically not cover anything out of network unless it's an emergency, so you need to be aware of that. This could be a problem if someone's traveling or they want to see a doctor, facility, or hospital outside of that network. See, Medicare Advantage plan networks, though, have become much better over the last decade, with many plans actually offering the ability to switch the network to the local area of where someone is actually traveling. That's why it's so important to give us a call here at Healthcare Solution Direct so that we can look at the different plans, and if you are traveling, make sure that you're in the plan that actually best suits you. An individual that may be concerned about network restrictions should really probably consider either a local or a regional PPO that might give them a little bit more access to care in or out of network. Medicare Advantage plans may also require referrals. So an individual with an HMO network may be required to get a referral from their primary care doctor to see a specialist. The reason behind needing to get a referral under an HMO Medicare Advantage plan is to prevent misuse of that plan and to help manage the cost. See, an individual that may be concerned about needing to get referrals should consider either a local or a regional PPO that typically do not require referrals, much like original Medicare A and B. So that's why it's so important to give us a call here at Healthcare Solutions Direct so that we can look at your particular needs so that we can best advise you on exactly what direction is the best one for you. Another drawback that some see on Medicare Advantage plans is that they do require prior authorization. So much like group and individual insurance plans, most all Medicare Advantage plans will typically require prior authorizations for services or procedures. This is something that's not required by original Medicare A and B. Medicare A and B does not have any types of checks and balances when it comes down to needing prior authorization. So that is a drawback with a Medicare Advantage plan where you will need to get prior authorizations before you get services and procedures. So most types of surgeries, procedures, or medical equipment will require prior authorization from the Medicare Advantage plan before being able to schedule it or actually obtain it. There are benefits and there are also drawbacks to both original Medicare A and B and Medicare Advantage plans. So it's really, really important that you take into consideration what is best for your healthcare needs. So we'd love to hear from you. Please give us a call so that we can actually look at your current situation and best advise you on exactly what the right path is for you.